Hi, everyone. I am going to be speaking to you today about what a picture exchange communication system, or PECS, is. I will also be teaching you about the importance of utilizing a PECS and explaining how to implement this type of intervention. So, what is a PECS? A PECS is a modified alternative and augmentative communication, or AAC device. So that means that a PECS uses icons, pictures, and or words to serve as an alternative method of vocal language. So how do we use it? How it works essentially is a client is given a laminated piece of paper or poster board or something equivalent with these pictures on it. The client can then point to the pictures, or if the picture image is Velcroed, it can be removed by the client, taken off of the board, and handed to another person to convey what the client is requesting from them. Some common images that are seen on a PECS are things such as eat, drink, bathroom, help, break, and play. With that said, why do we use it? These images function as a way for an individual who does not have any vocal ability or minimal vocal ability to ask for what they want and need. So PECs are commonly used with children and adults with developmental disabilities and or intellectual disabilities, in particular autism spectrum disorder, or ASD. It has been shown to increase functional communication for these individuals, which as a result has shown to increase social skills as well as speech output. So there are a few very important reasons to study the effectiveness of increasing functional communication by implementing a PECS. One reason is that children with autism need to grasp the concept that communicating their personal wants and needs is a necessary skill to be able to function properly in any type of social environment. Another reason it is important to study is that implementing a PECS has shown to increase both independent MANs and language initiations. One other important reason for studying a PECS is that it has proven to decrease maladaptive behaviors such as aggression, tantrums, and self-injury. Therefore, the implementation of this intervention serves as an appropriate alternative behavior to these types of maladaptive behaviors. So this is a pretty significant reason why it's so important. Some significant risks to not using this type of intervention to increase functional communication include poor academic skills, low vocational skills, and poor social skills. So let's talk about some of the advantages and disadvantages of using a PECS. One major advantage of a PECS is its easy implementation. A PECS is very easy to create and implement with clients. It also is unlikely that a child will become prompt dependent because of the PECS, since the skills being taught are meant to be forms of independent communication. Just because a client does not vocally man for needs and wants doesn't mean that the requests they make can't be independent if they're using a PECS. Another advantage to using a PECS is that it is usually very motivating for children to man for preferred items due to its visual appeal. This basically means that since the images of what the child wants or needs are right in front of them, that they feel encouraged and willing to ask for it, opposed to as if they did not have the items they want to request at to look at in their view. Another advantage of training staff and other professionals to implement it is fairly simple and does not take a lot of time. Therefore, it is convenient to use. On the contrary, a PECS does have some disadvantages. So one disadvantage of a PECS is that the client using it must first gain the attention of the communicative partner that they're speaking to or trying to communicate with before having the ability to demand for what they want and need. This may result in a delay of reinforcement, which will result in less motivation to request the item or activity again in the future using this type of strategy. Another disadvantage is that the communicative partner must be trained to use the PECs before the client utilizes it. Although this is not a difficult task, if a child asks or demands for something from someone who is not already trained to use a PECs or does not understand or know what it is, the child will not receive the item and most likely will not look to use a PECs again in the future. So now let me talk a little bit about the annotations that I did on this topic that support the idea that implementing a PECs is socially significant for children with autism. Research has shown that implementing a PECs is successful for teaching MANs directed towards both adults and peers. Paden et al. 2012 studied the effectiveness of teaching peer-directed MANs using a PECs and determined that it was significantly effective. In addition, Kodak et al. 2012 studied how a PECs increased peer-directed MANs for preferred items and toys. The results of this study also indicated that it was effective. Another few studies that I annotated determined the same outcome for implementing this technique to increase adult-directed MANs. So how does a PECs compare to other alternative communication devices or strategies? A peer-reviewed research study that I analyzed compared the implementation of a PECs to a speech generative device, or SGD, and to manual sign language. The results indicated that the SGD was the most effective at increasing functional communication, even though implementing a PECs or sign language was also effective. Another study compared a PECs and a SGD. The results of this study also indicated that implementing the SGD was more effective than a PECs. With that said, what about generalization of these functional communication skills and if they maintain over time? All the studies I analyzed that studied generalization showed that functional communication generalized across settings and individuals when using a PECs, which is a pretty significant finding. They also showed that the skills were maintained for long periods of time following an intervention, which is another significant finding. Some of the studies I analyzed utilize modified forms of the PECs. For example, the Kodak et al. 2012 study involved implementing the PECs in conjunction with extinction and a prompting program. Another study I reviewed involved using a PECs variation, which included tactile symbols for children with autism that were also blind. Another study I researched studied if a PECs would be as effective if the icons shown were constantly moved around on the board to see if presentation was important or not. This study proved that individuals were able to discriminate between the different location presentations of the images shown to them. Therefore, we can assume that the item itself being shown is the motivating factor and not the image presentation. Okay, so how do we implement a PECs in our fields of ABA? The first thing that needs to be considered is the types of items and or requests that are specific to that client. In other words, what does the client often ask for or need? What does the client usually struggle with requesting? Or what is the function of the maladaptive behaviors occurring that the child cannot ask for themselves? When those questions are answered, it's time to make the PECs. I use different forms of PECs with different clients, including a laminated poster board, a clipboard, a small laminated piece of paper, etc. It just kind of depends on the client's preference and what type of images will be shown on their packs. The most common images of the items and activities are then printed, glued, drawn, or Velcroed to the PACS board and given to the client. When first implementing the PACS, the client needs to be trained to use it. So this may require a high level of prompting at first before being able to fade the prompts and eventually make the man's independent. The PEC should be with the client at all times, and the professional who is implementing it needs to be trained prior to beginning the intervention. So let's now talk about some implications of implementing a PECS to increase functional communication. Implementing a PECS is simple, does not require many resources or time, increases functional communication skills, social skills, and decreases maladaptive behaviors. These are significant advantages because they result in the client having a greater chance at experiencing positive outcomes in their life. Independent manding and requesting is a vital skill that is needed to thrive in any environment with others. Also, if the maladaptive behaviors do not decrease, the harmful results are decreased skill acquisition and vocational learning, in addition to decreased social interactions. Therefore, using a PECS has shown to significantly improve clients' lives. Ethically, not implementing a strategy such as this does not allow for an individual to have appropriate methods for communicating. Communication is a key skill in experiencing the positive effects and emotions of life. Therefore, not implementing this type of strategy is unethical. So let's now talk about some implications of implementing a PECS to increase functional communication. Implementing a PECS is simple, does not require many resources or time, increases functional communication skills, social skills, and decreases maladaptive behaviors. These are significant advantages because they result in the client having a greater chance at experiencing positive outcomes in their life. Independent manding and requesting is a vital skill that is needed to thrive in any environment with others. Also, if the maladaptive behaviors do not decrease, the harmful results are decreased skill acquisition and vocational learning, in addition to decreased social interactions. Therefore, using a PECS has shown to significantly improve clients' lives. Ethically, not implementing a strategy such as this does not allow for an individual to have appropriate methods for communicating. Communication is a key skill in experiencing the positive effects and emotions of life. Therefore, not implementing this type of strategy is unethical.